usually CCP, we do a lot of academic work, but we want to get some family involvement into this as well. So with that in mind, under the leadership of Dr. Madhuvanti and Dr. Anushka Ediriveera, who are both council members, they are heading an initiative called CCP Families, and under that heading, we thought we will start this CCP book club. Now, as I outlined in the presidential address at the induction ceremony, one of our important skills that we want to master is our ability to communicate and relate to fellow human beings. And medical humanities have a huge role in that. And with that in mind, we thought we will have maybe a monthly book club. So today is the first episode. We asked via a Google form for members who'd like to join the club. Now we've got 32 responses, and actually 9 have volunteered to speak on books themselves, which is very, very encouraging to us in the initiative. So this will happen monthly, and if we get a lot of volunteers, it might happen actually more frequently than monthly. But at least monthly, we'll meet up to talk about a book. And I invite the CCP members to join the book club as well, because club will have its own WhatsApp group and will continue to discuss things. This monthly thing will be open to all members, but the book club will have its own set of people who, it'll have its own discussions going on about different books, sharing ideas, views, etc. So that will be an ongoing thing. It's not just a monthly thing. So I encourage you all to join the club as well. That's a different initiative, but that will be more frequent. So for today, it's the first lecture, and I'm greatly honored that my very dear friend and my colleague in the CCP Council for many years, my very dear friend, Diniti Fernando, has volunteered to speak to us. And we know how well Diniti speaks on books. She's done that before when she spoke about When Breath Becomes Air. So many of us who had not read the book went and read the book. So I look forward to a similarly stimulating discussion with Diniti, as well as an inspiration for us to engage in a greater measure with medical humanities. So without taking any further time, my great honor and privilege to invite Diniti to share screen and speak to you all. Thank you so much. Have a very pleasant evening.
Thanks a lot, Arosha, for that introduction. And I also want to thank you, Arosha, and Madhuvanti, and our book club team for this brilliant idea of the book club and all the hard work behind the scenes to make it a reality. And I'm extremely delighted to be starting off this inaugural reading of the series, and I'm really grateful for the invitation. And I also hope that this activity will provide the kindred spirits who have joined here a space to air and share our candid reflections of the good books that we've read. And I have no doubt that there will be learning for all of us, and the discussions will be stimulating, and of course will add new facets to our thinking, and sometimes may even make changes in our lives. Who knows, in how we learn medicine, how we practice medicine, and also how we teach medicine to our students. So the book I have selected is titled Slow Medicine, The Way to Healing by Victoria Sweet. When Madhuvanti contacted me about this activity, I was serendipitously engrossed in this book, which I got last December. And on an impulse, I agreed to do the first book read with this one. But later on, I was getting a bit anxious because the author uses stories from her own life to convey her messages. And hence, this book is a collection of little stories. And she goes into details in narrating these and draws from literary works and religious scriptures and history to enrich her experiences, that it is such a pleasure to read it, but makes it difficult to summarize it without harming the context and the content. Because the big picture is very important in getting the key message of all those little stories. Therefore, what I will try to give you today is a flavor of its 289 pages in the next 30 to 40 minutes. But I have one request. irrespective of your conclusion of my presentation today, please read this book. The book is very much more, it will be very much more than my presentation, and there's a very high chance that you will connect with it and find wisdom in it. So to set the stage for the reading and subsequent reflections, I will first introduce the author of the book. I discovered her about 4 years ago at the first ever Medical Humanities Conference in Sri Lanka, which was held in our faculty, which was the brainchild of Professor Saroj Jayasinghe. And in this conference, somebody, I can't remember who that is, mentioned her first book called God's Hotel. I read it and I was quite taken up by her writing and I wanted to read more of her work. Slow Medicine is her second book. Dr. Victoria Sweet is an associate clinical professor of medicine at the University of California, San Francisco, and a prize-winning historian with a PhD in history. She practiced medicine for over 20 years at Laguna Honda Hospital in San Francisco. And there she began writing. And her book, God's Hotel, is about her experiences in this Laguna Honda Hospital. So before I start off with the book, I want to introduce some words which the North Americans use and some other words as well, because they may be unfamiliar to some of us. They use the word college for university. Resident is a medical graduate who has completed residency and practicing in hospital or clinic, which is equivalent to a consultant here. A preceptor is an instructor to medical students. Locum tenens is a filler position for a physician. A community clinic is a clinic in the US that is operated by a tax-exempt nonprofit corporation, which is funded by the government, non-governmental organizations, grants, and so on. But it pays its salaries to the health workers through all these grants, but it bills the patients also. Middle Ages refers to the period in the European history from the collapse of the Roman civilization in the 5th century to the dawn of the Renaissance, roughly from 1000 to 1450 AD. An almshouse is a locally administered public institution for the homeless, aged persons without any means, a concept that is originating from medieval times, and America also had one or two. Haydn is Franz Joseph Haydn, the Austrian composer, who is also known as father of symphony. Hooding ceremony is the graduation ceremony of medical students in North America. Mantle of Hippocrates is a green velvet hood that is laid on the shoulders of the graduate at this graduation ceremony. And Bhagavad-gita is part of the epic Mahabharata, which is thought to be written by the sage Vyasa. And it's a compilation of Arjuna, Prince Arjuna, who is the protagonist, his moral dilemmas, and Lord Krishna, who is his divine charioteer, his answers. So Mahabharata is a long, long, long story, and the Bhagavad-gita is a 700-word poem, a 700-verse poem of that huge book. So medical student and a doctor, so therefore it's not autobiography, because talks about her personal life. She doesn't talk much. And so in the book, she introduces and explains the concept of slow medicine to the reader through her life's experiences as she traverses from the era of doctors, medicine, and patients to the era of healthcare providers, and healthcare consumers in the US. And in the chapters in the book, she tells us about her college days at Stanford University, the medical school in University of California, her internship in university clinic, and her resident days as a resident in psychiatry, which is very, very interesting, and other specialties, and her locum tenens, and all about her experiences as a clinic doctor in a small Mexican town somewhere close to San Francisco, and then about her days as a resident in medicine in a big hospital in San Francisco, and her experiences as a doctor in a community clinic, and finally, a doctor in this Laguna Honda hospital in San Francisco, which is the last almshouse in the US. So, Victoria enters college to study math and classics, and at the end of college, she is not sure what to do next, so she travels. And in a bookstore in Europe, she discovers Carl Jung. Carl Jung was a Swiss psychiatrist and a psychoanalyst who founded analytical psychology. And this is the book that Victoria finds in the bookstore and becomes fascinated with. And this is Carl Jung. And in the bottom picture in the center, the bearded man is Sigmund Freud. And for some time, Carl Jung was the understudy of Sigmund Freud before they fell out. And Victoria explains her fascination with Jung's philosophies. Jung had a philosophy of wholeness of things. Everything implies its opposite, and nothing is true unless its opposite is also true. Evil and good, night and day are all of a piece. And to be whole means not rejecting, but experiencing the other. Victoria wants to follow Jung's analytical psychology, and she contacts the Jung Institute to enroll, but she is told that she needs a doctorate in medicine or psychology to enter the Jung Institute, and she chooses medicine. At the medical school, Dr. Gurushanti, her preceptor, introduces her to slow, thoughtful, methodical, and meticulous physical examination, her first and perhaps the most important piece of slow medicine. And Victoria finds that white coats in the town uniform store are tailored only to suit men doctors. And she writes about the historical prejudices against women choosing to do medicine that has continued to 1970s, the period in which she enters medical school. Victoria writes, "It had been 120 years since Elizabeth Blackwell graduated from medical school, the first woman to do so since the creation of medical schools in 12th century Paris. Yet, of our school's 120 professors, only 2 were female. In the entire school, there were only 17 women. My class was the first year for which there had been a concerted effort not to reject women. So there were 9 of us in a class of 77. The 8 women ahead of us tried to help us out. They gave us a potluck and some tips. Try not to let the men crowd you out on the rounds. Watch out for Dr. Smith's hands. If all else fails, and you're about to be asked yet another obscure question you don't have the answer to, stare at their trousers." She continues, "It was a syllogism that couldn't make sense. Doctors were men. Women were nurses. And what, then, was a woman doctor? 100 years before, Dr. William Osler, Dean of American Medicine, had provided one answer. There are 3 sexes, He wrote, men, women, and women doctors. Victoria Sweet doesn't find this classification particularly helpful in explaining how she is made to feel about this indeterminate state of a woman doctor in the medical school. After finishing her clerkships in psychiatry, neurology, and pediatrics, Victoria starts her internal medicine clerkship at the county hospital. And the medicine department is at the top of the building. She grows to like internal medicine. She writes about her training in medicine. Medicine would be formative. It would prove to be the haven of the specialties, nonchalant in its expertise, its detached cheer, its brilliant method. And it was not only at the top of the hospital, but also at the time at the top of the medical hierarchy. It was a gentleman's specialty, untouched by the blood and guts of surgery. The distinction went all the way back to Greece, when surgeons were the low-class craftsmen who worked with their hands, scheres in Greek, while physicians worked with physis, with nature. When universities were established in the Middle Ages, that distinction became even clearer. Physicians went to the university and became doctors, from the Latin doctus, learned, educated, while surgery remained a handcraft of drawing blood, pulling teeth, and removing bladder stones. I hope our surgical colleagues will not get offended by Victoria's observations, because things have changed much after the Middle Ages, and the surgeons are now, they no longer belong to the craftsmen who draw blood, pull teeth, and remove bladder stones. They are much more than that. And she talks about her teachers in medicine, about the specialists she learned from. The medical internist was elegant to watch. Presented with a complicated case, he would listen intently. He would ask a question or two and then go over to the patient and elicit the one piece of information the student had missed, so obtaining the real story that made the history, physical exam, and lab results fall into place. Then, with soap-smelling, uncalloused hands, he would perform the essential test that proved his diagnosis. And last, with the 2,600 pages of Harrison's Principles of Internal Medicine in memory, defend his conclusion. The specialty of internal medicine has since fallen down the hierarchy, but at the time, it was the most prestigious of all. Then one day, she meets Dr. Greg, the attending, her first slow medicine doctor. Although he would have known what I meant by that, he would have said that what he preached and practiced was simply good medicine. Victoria writes on Dr. Greg. We doctors think we are so important, he told me. But the way it works is that in any disease, about a third of the patients get better, a third get worse, and a third stay the same. And all we do is to change who does what. Then he let go of the elevator door and it closed, and I never saw him again. But his words would resonate with me for the rest of my life. They were so strange. Was it true that everything gets better or worse or stays the same 1/3 of the time? And all we doctors do is change who does what? Dr. Greg was not the kind of person to steer me wrong. So I began to pay attention. And with this, Victoria starts reading the New England Journal of Medicine, particularly the clinical trials, and she becomes very much interested in the placebo set, which she calls Dr. Greg's set, and she observes what happens with the placebo group. Dr. Gregg was counseling me to be not a therapeutic nihilist, but rather a therapeutic skeptic. Every treatment, medication, or procedure, not every treatment, medication, or procedure is the miracle drug, the incredible advance that its marketing trumpets. Sometimes it is, and sometimes it isn't. So Dr. Gregg modeled me for what today I would call a slow medicine doctor. He was knowledgeable, thoughtful, and courteous, warm but not intimate, consistent and reliable. He knew his patients so well that when the time came, he did not have to go to the bedside of his now in extremis patient to discuss his advanced life directives. His thinking was crisp, which was why he was not sexist. Gender was not a significant characteristic for a medical student, he estimated, and therefore he didn't see it. So Victoria finishes her course in medicine, and at the hooding ceremony, the Dean of Medicine lays the mantle of Hippocrates on her shoulders, and Victoria Sweet becomes Dr. Victoria Sweet, MD. And finally, she feels that she is accepted by her patients as that Oslerian third sex, a woman doctor. She finishes a residence in psychiatry and decides it's not for her. And this is her take in psychiatry. This chapter is extremely interesting. Three Prophets, No Veil. I have no time to explain the title. It's a very, very interesting chapter. So Victoria says about psychiatry. Psychiatry asks the right questions, I concluded, as my internship ended. What is madness? What is sanity? What is reality? And who gets to decide? But it had no good answers. Medicine asks the wrong questions. What is causing the ear pain? Practical questions, not deep, interesting questions. But it did have the answers, and I preferred answers to questions. Then she joins Kaiser Hospital in San Francisco and stays on for several years. She learns what fast medicine couldn't do. By fast medicine, she refers to acute medicine, antibiotics, chemotherapy, everything that keep sick people alive and make them better. Especially from the case of Mrs. Irene Carmona, that what was good for the body of Mrs. C was not the same as what was good for Mrs. C. Permit me to dwell a bit on Mrs. C's story. Mrs. C is a patient Dr. Sweet manages in the ICU. It is a long and interesting and a tragic story how Mrs. C gets there, but Mrs. C is dying and she has many, many complications. However, Dr. Sweet is not ready to give up on her. In spite of the advice by an experienced ICU nurse and subtle signals by the attending physician, young Dr. Sweet does all in her power to treat Mrs. C's body by correcting fluid, correcting electrolytes, correcting proteins, giving blood and therefore correcting hemoglobin, while all the time Mrs. C keeps wasting, losing her hair and teeth, becoming unresponsive, past the point of no return. Finally, Mrs. C dies after 63 days in the ICU. And Victoria wonders whether her decision to treat Mrs. C's body was correct. And she appreciates the clinical judgment of her supervisors. Victoria is yet to master it, but she observes that sometimes the confidence the best attendings had was like a tuning fork for the body. Victoria sees a resemblance of her moral dilemma with this quote from Bhagavad-gita. The painting shows the battle of Kurukshetra, where Prince Arjuna is compelled to fight his own relatives. Krishna is his divine charioteer. Victoria writes, I remembered the beginning of the Bhagavad-gita when Prince Arjuna asked Krishna whether it is ethical for him, the prince, to join the battle of one side of his family against the other. Krishna answers, if any man thinks he slays, and if another thinks he is slain, neither knows the ways of truth. The eternal in man cannot kill. The eternal in man cannot die. Wherefore, do thy duty. There were no Pandava ethical guidelines for Prince Arjuna, who is the protagonist in this epic, Mahabharata. Just as there were no American guidelines for Victoria in managing Mrs. C. Arjuna had to trust his judgment and decide for himself because in certain situations, it is almost impossible to decide what's right or what's wrong. Krishna very cleverly leaves him to decide. I was amazed and at the same time delighted at this reference to Bhagavad-gita by this white American doctor of German descent. Before she takes up her long residence in medicine, Victoria joins a trekking group from Kathmandu to Mount Everest as the trek physician. Her intention is to experience the Middle Ages along this trek. As they walk across the mountains, what she experiences is the indispensability of fast medicine. She imagines Nepal to be as medieval as you can get, with hermits and monks and pilgrims, and of course, medieval medicine of herbal concoctions and potions. But she's in for a surprise, for what she encounters in Nepal is not medieval medicine, but no medicine at all. If it was there, she doesn't find it. Instead, she sees people using river boulders as latrines and other people drinking the same water downstream. Little children with runny noses and eyes covered with flies. Women cooking in windowless houses and the burn injuries of infants, tuberculosis and other infections. Victoria continues in the trek from pass to pass, mountain to mountain. While on the trek, she comes across an Englishman who lives in a wood cabin at the foothills of the Himalayas, who actually turns out to be the retired chief magistrate in Hong Kong. She calls him Mr. English. And Mr. English has pricked himself with a thorn at the back of his knee, which is inaccessible to him, obviously, and now it is infected. So Mr. English asks Victoria to treat him. She has a set of simple surgical instruments, iodine, morphine, and some antibiotics with her, and she obliges. Had our group not come along with fast medicine in a little tin, Mr. English's thorn might well have festered and turned septic. So Mr. English put the Middle Ages into perspective for me. Whatever I mean from them, their quiet, their values, their worldview. I was glad of my fast medicine technology. If Mrs. Carmona's tragic dying was an example of too much fast medicine, then the mosquito clamp in my aluminum tin was an example of just the right amount of fast medicine for the job. So after her intermission, Dr. Sweet takes up work as a doctor in a community clinic. She is the internist and she is consulted on complicated cases. The other workers in the clinic ask for a small wage raise, but the petition is rejected by the clinic director and the board, which she calls upstairs. Dr. Sweet supports the workers. The union agrees, although their petition is rejected, that they cannot strike because it wouldn't be ethical to walk outside and picket while they, meaning patients, were inside, sick. Dr. Sweet suggests moving the clinic, which she calls downstairs, out of the building to a trailer and see the patients in it. She says, but we won't bill. We will still care for our patients downstairs, but there will be no money for upstairs. The workers get their raise. While working in the community clinic, she spends her free time in the local library, reading about Chinese medicine, Ayurvedic medicine, Native American medicine, history, anthropology, folk medicine, and she discovers someone called Hildegard of Bingen in the library. Hildegard of Bingen is a 12th century German nun, visionary, composer, and medical practitioner who wrote a medical text. And she finds Hildegard's medicine to be a lot similar to Chinese and Ayurvedic medicine. The last few chapters of the book are laden with very interesting information on this Hildegard of Bingen. Then she takes up a post as a doctor in Laguna Honda Hospital in San Francisco, an almshouse, the last of its kind in the US. There she practices slow medicine along with fast medicine. I would still use the brilliant method I'd been taught in the medical school. I would still, that is to say, lead with fast medicine, with the model of body as machine and doctor as a mechanic. But I would also, at the same time, at the back of my mind, be practicing slow medicine. I would also think like a gardener and see the body as a plant. I would visualize him within his environment, like a camera zooming out. Were there medications I could discontinue, discomfort I could assuage? I would find myself a kind of fast medicine and slow medicine together, mechanic and gardener, focused and diffuse, the parts and the whole. She completes a master's degree in the history of medieval medicine, which is titled Earth, Air, Water, Fire, the Medicine of Hildegard of Bingen, and then reads for a PhD, the title of the thesis being Body as Plant, Doctor as Gardener. And she lives through the transition of the hospital to a new, shiny healthcare facility and witnesses the dawn of administration, business, science alliance in the US. Administration demanding the cheapest possible service, business agreeing to provide it, and science providing tools to allow that to occur, at least in appearance. After 20 years of serving Laguna Honda, Dr. Victoria Sweet leaves it. Then she writes her first book on her experiences there, God's Hotel, a Doctor, a Hospital, and a Pilgrimage to the Heart of Medicine. In the last chapter titled A Slow Medicine Manifesto, Dr. Sweet further elaborates on her philosophy of slow medicine. I will not go into the details of that. This is what she has posted in her official website, Slow Medicine in a Nutshell. Medicine works best, that is, arrives at the right diagnosis and the right treatment for the least amount of money when it is personal and face-to-face, when the doctor has enough time to do a good job and pays attention not only to the patient, but to what's around the patient. Dr. Victoria Sweet calls this approach slow medicine, and she believes that put into wider practice, it would be not only more satisfying and beneficial for patient and doctor, but also less expensive for everyone. Finally, instead of lessons, I want to leave you with some questions which has come upon me after reading this book. The answers and the subsequent learning, I guess, is going to be different for each of us. Here are my questions. Are we the teachers to our students that Dr. Greg, Dr. Gurushanti, Dr. Craig, and Nurse Kathy were to Victoria? Are we the proper master craftsmen, women, to our apprentices? If not, why? Can we use the models of slow medicine already existing in Base Hospital Wallaby or Base Hospital Point Pedro or with the village Veda Mahatya to our advantage? Do we need that? If so, can we do more to bring slow medicine from periphery to the fore? Or are we happy to be taken over by the administration, business, science alliance? I'm not sure how many of you were at the first session called Periphery to the Fore, which is something new that Arosha has introduced this time to the CCP. There were two brilliant presentations by the physician of Base Hospital Vallabhaya and Base Hospital Point Pedro and Dr. Jagat Pushpakumar. I think it occurred to me that he was practicing the best possible combination of fast and slow medicine when he talked about how he did that urgent pericardiocentesis in that dying illiterate patient farmer who refused the management. And in his own words, Dr. Pushpakumar said that when he refused, I counseled him. And he learned how to do it from a cardiologist in Colombo and through other means that are available to us by the internet. And he did it successfully. So this is the second question. And finally, what's stopping us from telling and writing our own stories? We have lots of stories from the US. There are many, many contemporary physician writers like Atul Gawande, Abraham Verghese, Siddhartha Mukherjee, Victoria Sweet, Oliver Sacks, and so on. And they tell their stories so well. And there is sincerity and credibility in what they say about how they have practiced medicine and how they have failed as well as how they have succeeded. So what's stopping us? Is it fear of exposure? Is it poverty of expression? Or is it lack of a wider perspective? So I would thus leave you with a few triggers to think about, if you may, and invite you again to read this book. It is much larger than the presentation that you just witnessed. So I want to thank you for being present here with us today. And I thank Arosha, Dinesha, Madhuvanti, Chandimani, and Anushka, and also Danuka and Ashan, our young pre-interns who made that beautiful video, for all the hard work behind the scenes. And I hope that you will join again for the next session of the CCP Book Club. Thank you very much.
Thank you very much, dear Madam Professor Diniti Fernando. It's actually great. Indeed, it's a very well eye-opener for all of us. I think this is what our president viewed as from book club, actually thinking beyond medicine and thinking beyond fast medicine, as you call it. So thank you very much again, Professor Diniti Fernando. And it is time for a discussion or any comments from the audience right now.
Thank you, Diniti, for absolutely, in my thought, absolutely wonderful talk. I hope others will also express their opinions on various matters. But one thing which really struck me was your invitation for us to write. I think that's important because there are many. I personally know some of you all write so very well, and you have written very good textbooks. So my invitation is, shall we all look at writing, going beyond the textbook, but then writing something related to our experiences. So I hope to see that happen. And I know that people like Dr. Sarath Gamini have actually penned down many a poem which describes their experiences and their thoughts on patients and the profession and the direction it should take. So, I mean, that has been quite inspiring. I hope the others will also take the cue. I myself have started doing something very little. Every week you get a CCP weekly, and I try to write a president's column in which I try to bring out some of my personal thoughts. I invite you all to read that every week. The past few weeks I've been writing that, and then of course to respond to that and then write back with your thoughts, and then we could actually share some of those thoughts in future CCP weekly, because it's electronic format. It's very easy for us to incorporate. So do write. I mean, I write my own column. So do write. When I bring up an idea, I invite you all to actually respond to that and actually write what your thoughts are, so that we can share that with the wider readership. That's all from me. But I hope others will also speak with Diniti and express how they feel and which future direction we should take. And then, of course, we will definitely have this as a monthly activity and invite those who have volunteered, and perhaps coerce those who have not volunteered also to speak about a book. Thank you, Diniti, once again for an absolutely wonderful, wonderful session. I am so grateful by your talk.
You're most welcome, Arosha, and it was a great pleasure. That's the book. That's my book with many tags on it. It's a treasure, actually. So I hope all of you will be able to get a copy and read it. And I actually, when I was thinking about physician writers, I was thinking of people like Dr. Sarath Gamini De Silva and Dr. Raghunathan and Prof. Saroj Jayasinghe. Like, I mean, they have written a lot, and Professor Panduka Karunanayaka has written an excellent book on education. But what I meant was like, stories, real experiences of your clinical life, your professional life, your teaching life. Because like the authors that I mentioned who write in English, they express them so well, and there is richness in their articulation and also credibility and a lot of sincerity, because they do not only talk about like their victories or their successes, and they talk about their own fallibilities as well, which makes it more believable and more kind of realistic. So that is something that I would really like to see. And there are, I see many writers on social media. There are lots of doctors who write on social media, and some of them are really very, very excellent writers. And I hope they will take the lead, this younger generation, and they will start writing on their experiences, so that the future generations of doctors also will learn, reflect, and grow with those. And thank you to the people on the chat who have posted messages. Thank you very much for being here. Really appreciate and honored that by your presence.
Dear Madam, like I'm Dinesh. Thank you so much for the excellent presentation, and this is indeed an eye-opener. I haven't been a great reader, but you have inspired us to read this book, not only just this book, but also to start reading, and also the practicing art of medicine. So thank you so much for joining us today, and we hope you will be joining in the future as well with us. Thanks.
Thank you, Diniti. Can you hear me?
Yes, sir. Thank you so much. I know it's very late for you.
Yeah, it's but I have no regrets at all. Absolutely brilliant. And thank you, Arosha, and thank you, Diniti, for this wonderful thing. You have opened eyes of many of us who don't read to the amount you read and write. And of course, this is absolutely the medical humanities. I was there in the first conference you were quoting in the faculty when Saroj started this. And I think the CCP and under Arosha's, I think this will get more and more. Thank you very much. And you really inspired us. Thank you, Diniti. And thank you,
for being
Arosha.
here, sir. Please write your experiences, sir.
Will do, will do. Thanks.
Diniti, are you still around or can I
I'm here, sir.
say something? Yeah, anyway, I joined a little late, but anyway, I really enjoyed. Thank you very
Thank you,
much for
sir.
that. Two problems I have. One is these books. I don't have your book, but I have kind of similar many books which I buy occasionally. But they are meant for not for doctors, isn't it?
Yes.
They
yes.
write for the public to read. So my problem is when I start reading, halfway I get really kind of a bit bored and then I stop reading.
Yes.
So that's my one problem. But if we want, then there are also books on medical humanities, medical ethics, special books meant really for doctors. So that's one issue I have. These books really meant for the public. So they are written in a, nice language, but sometimes you get a little, thinking, well, we know all this kind of thing. Then the other issue is writing. I don't think everyone can write. The writing authorship is also very special. You need to have a very good grasp of the language. And also I think, if you start from people like Sherlock Holmes, Conan Doyle, Oliver Sacks, and then coming down to these authors, current authors, they are really, very good writers. So your suggestion is fine, but not everybody can write. So what's your solution to that?
Well, sir, I suppose the starting point would be to start reading, because I find that many of the medical students that I teach, like they find it really hard to articulate themselves, express themselves, like during even in their own language. It need not be in English, but even in Sinhala. So that richness of expression, that language is not there. So I suppose a starting point would be to read and go through a wider range of things. And also like our students, like the medical students who enter the medical faculty through the local curriculum, the exposure to the humanities that they have is like not given emphasis, not given prominence. Whereas in other countries, like I think it's almost essential that you do a subject, select a subject in humanities, like could be history, it could be literature, but like then you do it seriously. You don't do it just for the sake of doing it, but you do it by choice. So that would be something that we need to think about. When we admit students to our medical schools, like the amount of emphasis that we give to this kind of thing. And also, as you say, like I know that people, writing is also talent. And but the thing is here, even people who have that talent, they are not inclined to write. So I do not know whether it is because of this like amount of work that they do, not only in the hospital, but also away from the hospital in their private practices. And there's hardly any time, I think, for this kind of reflection and this kind of exercise.
I think we are also responsible for this, because what we have done is we have taken out from the medical curriculum where students write. They don't write any essays for it. They
Yes.
don't. From what I know, I mean, our students don't write any essays. We don't assess them on that. And even for exams, they don't write. And even during the course, I don't think they are given to write essays, and they are assessed and they are advised. So the writing skill is completely taken off. It's structured things, MCQs. So I think that may be also, you know, an important thing to think about.
Yes, agree with you, sir, and also agree with you about that these books are not actually meant for doctors, like they are meant for the general
But
public.
it's interesting, really. Yeah.
But I think at least like now in our setting, if we at least start reading these simpler books, that will be a beginning. Before we go on to advanced stuff which are written exclusively for doctors. So it would be a good start and better than nothing, sir.
Yeah.
Thank you very much, sir, for your comments and
really
input,
enjoyed.
sir.
Thank you.
Thank you very much all for attending, and that was a great discussion. We all looking forward all to see you all in next our next monthly CCP book club, and I invite all CCP members to join the book club itself and monthly event as well. So till we meet again on this kind of session again, have a very good night to all.
Thank you very much.